Let's talk about the dominant theme this World Health Day. It's a focus on, help me now, antimicrobial resistance. What does that mean?
Right. Thank you so much for having me, and good afternoon. And it is so important because they've made this the theme of the World Health Organization's day today.
Yeah.
What does it mean? Essentially, what we're talking about here is the resistance to antibiotics. And why this is so important is that it demonstrates that today healthcare is more global than ever before. Before, when you think about significant contagions that have traveled the world, they've done so over many months or perhaps even years. Today, though, we know the story of some of the most recent contagions that have come through, whether they come from Asia or South America or elsewhere, have come very, very quickly. Airline travel, the shipments of goods, logistics have all meant that we're far more interconnected.
Right.
And what it really means is that it's incredibly important for us to have grip on resistance bacterias that will become challenging and difficult to treat with our current stock of pharmaceuticals.
I mean, obviously, Africa is the bugbear in this situation. We're always seen as the continent most susceptible to disease, to destruction, to all sorts of problems. Has that changed in any way?
I wouldn't just say this is an African problem. I would say that this is a global problem, and here's why. It's that we see many different strains of antibacterial or strains of cases in where our current stock of pharmaceuticals are unable or unsuccessful and able to treat those. We have that in Western hospitals as well. This is essentially what the story of hospital-borne infections are about, or MRSAs, or C. difficile. So those are examples of cases in many hospitals around the world where we're treating those. And to the extent that today we've been able to treat them successfully. The risk, of course, is that we don't invest in pharmaceutical research. The risk, of course, is that we don't have proper primary care. The risk, of course, is our over-reliance on using our medications, and as a result, that builds up a resistance, and that resistance will then make these drugs.
Why is there this deficit in research? Apparently, in this area of research on antibiotics, for instance, only 2 major pharmaceuticals are leading the way.
There's a combination of things, to be quite truthful. The first is that different governments have different policies on primary research, and to a very large extent, this is about basic primary research. And that isn't always necessarily picked up by industry. And those governments around the world that fund basic primary research will be in a much better stead for that. The second is that questions obviously around patent and patent rights, but whether or not the pharmaceutical industry believes that they'll be able to recoup the potential significant investment in making the types of investments that they need to do around research and development, in trading off that against many other drugs. Right. And lastly, the question about the market. Just really how big is that market? And so how does that get rewarded?
When you look at the problems in Africa in terms of tackling some of these problems in our healthcare system, does the problem lie with government and the inadequate supply of public healthcare facilities, including research? Is it a lack of investment and involvement by pharmaceutical companies? Is it a problem with the citizens and their lack of education?
It's a lack of what I would call capacity. My view here in Africa certainly is that we can tackle a great degree of our public health issues as well as people's personal health issues if we were able to invest in primary care. The biggest step change we can make in Africa in terms of life expectancy, in terms of being able to tackle these types of diseases, in terms of being able to tackle diseases that quite frankly our children shouldn't die from today, is really a question about building local capacity in our communities, and capacity that can deliver the kind of care that we want. That's primary care doctors, it's community matrons, it's community nursing, it's those types of very specific programs.
How can we bridge that gap? Because a lot of African governments are signatories to the Millennium Development Goals. Yes, we're not going to reach the targets in 2014, but there's a sense that the political will does exist.
And different countries are experimenting with different options. So you'll know that in South Africa, for example, there's been significant discussion about the national health insurance system, which is really the question about how is it that we bring much better care to millions more South Africans, rightly so. In other countries, they're experimenting with different models. Recently in Nigeria, for example, they've just passed a new piece of legislation, a new policy that expands public health insurance to many state workers. They're looking to expand that even further. So you're seeing different types of governments take different policy options to address this important issue around public health.
Prevalent health issues, which unfortunately just don't seem to be going away. We don't have a grip on them. HIV and AIDS infections, tuberculosis, malaria. These are the three biggest killers, we're told, in Africa. Why are we struggling to get a grip?
Multifaceted. The first really is partly about the capacity piece that I talked about. It's absolutely possible for us to be able to get much tighter grip if we're able to tackle access to good quality, safe, effective primary care in people's communities that is close to where people live. The second really is very much so a question about how we prioritize these three aspects within each of the countries, and countries have taken different measures around how we prioritize them. Partly this is also a story about people's poverty and about the challenge about addressing some of these issues when we have other social and economic issues that also need to be addressed. I'll give you a very, very clear example about one. We can absolutely roll out antivirals to millions of Africans. That is absolutely the right thing to do. But if their stomachs aren't full, then it's going to be incredibly difficult for them to be able to withstand the difficulties of the antiviral medication. And so this is a multi-process, this is a multifaceted approach. And that's an incredibly important aspect around public health.
Well, this year for 2011, the World Health Organization is targeting a 6-point policy plan, which wants to see collaboration between government, between pharmaceutical companies, between doctors and medical practitioners, between the community. Let's talk about industry's role in this. What is it that pharmaceutical companies can do in support of the priorities that Africa faces in healthcare and making it profitable at the same time?
Not just pharmaceutical companies. This is actually a much broader piece. Look at many of our clients are looking at investing in healthcare in Africa. This is about primary care, being a provider. This is about activity around being a payer, so as in medical fund schemes, and about the role of insurance and being able to insure the growing, significantly growing middle class of Africans that are demanding insurance from their governments. That's partly what the NHI is about here in South Africa, isn't it? The story about Nigeria. And then lastly, pharmaceuticals, which is a two-part strategy. First, my view is that pharmaceuticals need to be more than just a transmission belt. That is to say, they need to be much, much more than just taking a product and moving it into the continent. This is much more about generating a very local base of generics that can compete, that can provide jobs, that provide the research base, and that harness the real potential that we have here.